Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about the often misunderstood diagnosis of bipolar disorder. Bipolar disorder doesn't discriminate. It affects people from all walks of life. Lifetime prevalence: 1 to 4% of people will experience bipolar disorder at some point in their lives. The average delay in getting a correct bipolar diagnosis can be several years. It is often diagnosed initially as depression alone, leading to prolonged suffering. Individuals who have spoken out. Faye Dunaway, the Oscar-winning actress, shared her diagnosis in a 2024 documentary. Mel Gibson, the actor and director, has spoken about his diagnosis. Mariah Carey, the iconic singer-songwriter, revealed her diagnosis in 2001 and advocates for managing the condition. Russell Brand, the comedian, actor, and author, has discussed his experiences with bipolar disorder. Individuals thought to have bipolar disorder. Vincent van Gogh, the iconic painter, known for his emotional intensity and prolific output, was posthumously diagnosed by some experts as likely having bipolar disorder, which may have influenced his artistic periods. Isaac Newton, the father of modern physics, known for his groundbreaking work on gravity and calculus, some historical analyses suggest he exhibited behaviors consistent with bipolar disorder, including intense periods of work and possible manic episodes. Understanding the core difference: bipolar 1 versus bipolar 2. Bipolar disorder isn't a single entity. The key difference lies in the highs. In this diagram, you see bipolar 1 in blue, with significant mood swings from severe mania to depressive episodes. Bipolar 2 is shown in purple, with mild hypomania swinging to depressive episodes. Bipolar 1 disorder, key feature: at least one manic episode, the most severe form of elevated mood. Mania lasts at least 1 week with abnormally elevated or irritable mood and increased energy, often requires hospitalization due to severity. Depressive episodes may occur, but are not required for a bipolar 1 diagnosis. Hallucinations or delusions may occur during mania. Bipolar 2 disorder, key features: at least one major depressive episode, at least one hypomanic episode, a less severe form of elevated mood. Hypomania, elevated mood and increased energy, but not severe enough to cause marked impairment or hospitalization. No mania. Crucially, there are no full-blown manic episodes. Depressive episodes. Major depressive episodes are a core feature. Potential positive traits. It's important to acknowledge that some individuals with bipolar disorder report certain strengths, but these are complex and intertwined with significant challenges. Heightened creativity. Some report periods of increased creativity, especially during hypomania. However, the disorder's instability can also hinder creative processes. Intense emotions. Bipolar disorder can involve experiencing emotions with greater depth. But this intensity is often accompanied by significant pain and distress. Resilience and strength. Living with bipolar disorder requires immense resilience and coping skills. Individuals often develop a profound understanding of their mental health. Hypomania can sometimes bring periods of intense focus, but this focus is often unstable and can be disrupted by other symptoms. The danger of misdiagnosis: why it matters. Bipolar disorder is frequently misdiagnosed, often as a major depressive disorder. This is because depressive episodes are common to both, but the treatment is fundamentally different. Treating bipolar depression with antidepressants alone can be dangerous. It can trigger mania, hypomania, or rapid cycling, worsening the condition. Accurate diagnosis and appropriate treatment are essential for long-term stability and well-being. Medications are fork in the road. Bipolar disorder, the mood stabilizer focus. The cornerstone of bipolar treatment isn't just relieving depression, it's about preventing the entire spectrum of mood disorders. Mood stabilizers, these are essential. They're not just antidepressants, they're the foundation for long-term stability. Examples include lithium, valproate, lamotrigine, carbamazepine. Antipsychotics, often used alongside mood stabilizers, especially for acute mania. Some also have mood stabilizing properties for maintenance. Antidepressants, a word of caution. Antidepressants can be used, but with a critical caveat, always with a mood stabilizer. Danger: antidepressants alone can trigger mania or rapid cycling in bipolar disorder. Well, I hope you have found this talk informative, and please subscribe to the channel.